How have you been feeling?
Good.
Yeah?
Good.
Have you been checking your blood sugars regularly?
Yeah.
Okay.
My wife keeps an eye on it.
Does she? Well, that's good. That's good.
Between 2008 and 2011, more than 6,500 patients with diabetes were directly impacted by the Partnerships for Health program. Now many more will benefit from the new skills and knowledge gained by the team members because the concept of the program is continuing, now called Partnering for Quality in Chronic Disease Care.
The Southwest LHIN was involved in a very successful project that spanned 3 years, the Partnerships for Health project, which was really looking at how health service providers work together to deliver improved chronic disease care. And so we had a number of primary care teams working with the Community Care Access Center, diabetic education centers, and other health service providers to improve care for those individuals with diabetes. And so we're learning lots from that initiative and looking at ways to sustain the gains that were made across the primary care teams that participated and spread that project out to other teams. And so we've relaunched that initiative as Partnering for Quality in Chronic Disease Care here in the Southwest LHIN.
The QPI team is now focusing on how to sustain the gains made by Partnerships for Health and spreading their successes onto other areas.
Currently, the Quality and Process Improvement Coach is meeting with all of the teams, which are 27 teams across the Southwest, and understanding what their needs are and come up with a plan. So currently, some of the needs that are involving are those related to the electronic medical records across the Southwest. And currently there are multiple systems, and in order to sustain the good work that's already been done, one of the current objectives is to create a manual for the EMR systems that when a new person comes or a knowledgeable person leaves a family health team, they will have that written document available for them.
Well, I think it's building on the strengths that the Partnership for Health program has already achieved. And some of the key parts of that are really understanding what the client's journey is and understanding how we partner together in order to support that client. So the disease is probably less important than the process to ensure that we know what the resources are, we have access to those tools, and that relationships are built to facilitate that client's journey.
Then you've talked about the doctor has to gather all the baseline data, so are you gathering at that point the
Tamara
A1C,
McAllister is a QPI
the 14
coach.
indicators or the 5 indicators? By bringing a different lens into the environment, what I'm allowed to do is really help them look at continuous improvement from a different perspective. Not just it's about client and patient care, but it's also about what are you doing and who's doing it, and are you doing it the most effective and efficient way. So a lot of times when you're involved on a day-to-day basis in the things that you're doing, you don't realize what you do affects the next person upstream or downstream of the process. So as a coach, what we're able to do is come in and assist that team in looking at everyone that's involved.
A total of 73 primary care practices participated in Partnerships for Health. Physicians like Dr. Sue McLean say it has forever changed the way her team works together.
The advantage of Partnerships for Health was that it created partnerships not just with local community resources and with the LHIN, but also strengthened the partnerships within our team. That was a side benefit that we didn't expect, and it also improved the partnership between the patient and the physician. I think now we look more upon it as a collaborative role rather than telling the patient what to do. It's basically how can I help the patient do what they need to do.
CCAC case manager Jackie McGregor says the program not only helped patients, but also helped form valuable connections between the CCAC and other care providers.
I think before, and we would hear, the diabetic educator, I didn't know I could just call you. We made so many connections with the dietitian, the diabetic educator, that we were all working to avoid duplication. Our community nurses, I think, paired up with the diabetic educator then as well if we had common clients. So that was really interesting to see how much we could gain from each other, because at a doctor's visit it's a 10-minute assessment, where if we can provide the information of what that person's doing day to day at home or what the nurses are finding, the physician's better prepared for that visit, and at home we have better communication with up-to-date orders and treatments and the communication with the physician.
Sustainability is key to any project, and I think it's the hardest thing to maintain. I think every project needs a champion, both internally and externally, to keep the momentum going, but we're doing all we can to keep this project going.